Welcome back to the Medical Podcast, in which we'll be discussing disease prevention, health promotion in the most practical way possible. I'm your host, Michael, a third-year medical student in Aristotle University of Thessaloniki in Greece. In this episode, I'll be discussing about infertility following an eye-opening conversation with OBGYN Dr. Dimitrios Goulis last week. He gave us a lot of insights into the life of a doctor who deals with infertile couples on a daily basis. The link to that episode will be in the description. By the end of this 17 minutes, we'll answer three big questions. Is infertility a problem? What can medicine do about it? And very importantly, what can you do about it? Alright, let's start before it's too late. Before we can answer those three questions, we should know the definition of infertility. So by WHO, infertility is a disease of the male or female reproductive system defined by the failure to achieve pregnancy after 12 months or more of regular unprotected sexual intercourse. So in other words, if you have tried for more than a year of having a kid the natural way, and you haven't succeeded doing so, you may have infertility. Now for me, this definition is slightly surprising for a medical student because it is termed as a disease. For me, I always thought of disease as something, let's say, the insurance pay for. And for sure, the insurance wouldn't pay for infertile treatment. That's why it's a bit surprising to me. Now, for the first question that we have to talk about, is infertility a problem? I'll give you guys some numbers to think about. In a study in 2010, almost 50 million couples are somehow infertile, and 14.4 of those live in South Asia. Back in 1990, this number was 42 million. So there has been 8 million increase within 20 years. Last year, WHO published a report saying that 1 in 6 people globally is affected by infertility. Now they use the word affected, not to actually have infertility. So this might be a little bit misleading, but still a huge number. If you're looking at the big picture with the aging population and the trend of people wanting to have less and less kids, it is a very worrying sign. However, from the interview with Dr. Goulis, when I asked him about the state of couples when they come to him for treatment, he said, and I'm quoting,
I'm trying to get them to understand that it's not my or your problem. It's not a male or a female problem. It's ours, our thing. It's not even a problem. Because if you start accusing each other that that's up to you, then they divorce. Believe me.
wow.
Yes.
So that gave me a brand new perspective because I've never been in that shoes. I always thought of it as a problem because there will not be as many young people in the future. That's why I thought it's a problem. But if you are from the point of view of a couple trying, or even the doctor that is helping, it is not a problem. I think it's just a challenge that you have to get through together. If you look at it as a problem, you would probably be more discouraged than encouraged. What can be done? What exactly can we do? Before we can answer this question, there are causes of infertility from a medical standpoint that you have to be aware. There are things that affect both gender, things that affect only female, only male. However, if you look it up, most of these are, let's say, unpreventable, meaning that it's random or it's more likely genetic. However, there's only one thing I believe, that you can do that will dramatically reduce your chance of getting infertile, which is related to your lifestyle. Lifestyle factors include, first of all, frequency of coitus. I think it's well known that a week after the menstruation of the female is the week of ovulation. However, this varies from people to people, so it might not apply to you. Anyway, if you have sex in the week of ovulation, you're more likely to conceive. Next, we have diet and exercise. It is also very well established that calorie restriction and excessive exercise also lead to the reduction of ovulation frequency, meaning that if you are trying to lose weight or if you exercise too much, you might ovulate less for women. Alcohol for women, it decreases FSH secretion, meaning that it will harm the growth of egg ovulation, and for men it decreases testosterone. In the interview with Dr. Goulis, we talked about stress and anxiety. He believes that this is the biggest factor that affects the couples when they're trying to have a kid. He said that
if you work 10 or 11 hours, you don't think about sex when you go back home, okay?
If we go a bit deeper, for people who have severe depression, they also seem to be associated with decreased level of testosterone and overall affecting the spermatogenesis. After that, we also have obesity as one of the factors that affect fertility. Obese men were 42% more likely to have a lower sperm count than the normal weight people, and 81% more likely to have no sperm at all. This was a study by Harvard School of Public Health in 2012. We also have smoking and drugs as a lifestyle factor. I think this is pretty obvious. Other than that, exposure to certain chemicals such as lead, ethylene dibromide, vinyl chloride. Now, one last thing that you can do, and it doesn't relate to lifestyle, but it is something that have to be talked about, which is STD. It is very much suggested that to get your STD treated. Some STD can directly lower your chance of having a kid, and some can indirectly do the same damage. For example, we have pelvic inflammatory disease, most often caused by gonorrhea or chlamydia. What happened during this disease is that you will have scarring of the cervix, the vagina, ovaries, or fallopian tubes or uterus. Basically, it means that the environment for conceiving is horrible. PID, pelvic inflammatory disease, is in a group of disease called tubal factor infertility, which accounts for 25 to 35% of female infertility. Indirectly, HIV, HSV, HPV, or syphilis can also affect your fertility. It is really important to treat all these STD before you want to try to have a kid. First of all, it's for the safety or the future of your kid. And second, as I've mentioned, if some of these things persist, it's difficult. It's more difficult to conceive. Now, so far we have been talking about things that you can do. How about things that medicine can do for you? The third question. For female, there are certain drugs that can treat a couple of problems. For example, there are drugs that can stimulate ovary, can stimulate ovulation. There are also surgeries that you can do if you have some very niche problem like blockage of fallopian tube, or maybe some fibroids or polyps, or some scarring even. For male, there are some drugs that can help with erectile dysfunction or problem with ejaculating. And for surgery, there are also some very niche procedure that can be done, but there are things like varicocele in a testicle or issue with a tube that carries sperm called vas deferens. Well, These things are for people who have actual, let's say, anatomical problem or even hormonal problem. Keep in mind that you should always consult your doctor before making any decision about your condition for medication or surgery. If you have tried the normal way for too long and you still haven't succeeded, it's time to turn your head into assisted reproductive technology. First of all, we have to talk about intrauterine insemination or IUI. This procedure inserts healthy sperm into the woman's uterus around the time of ovulation. It uses a long, narrow tube to insert the sperm, and it can be done in the doctor's office. We also have IVF, very famous, in vitro fertilization. This is a more expensive and complex compared to IUI. While they can be successful, there's no guarantee either IUI or IVF will result in a pregnancy. When we talk about these procedures, we always have to talk about the success rate. This takes me back to the conversation we had with Dr. Goulis. In the end, we had a closing tradition in which we ask him if he sees an opportunity or problem in his field that is being overlooked, that should be talked more about. He wrote down to positively interfere with the IVF procedure and rise the birth rate, not only the pregnancy rate. This took me by surprise a little because I assumed that when you get the IVF treatment, once you get pregnant, it's pretty much guaranteed that a baby will be born. However, it seems that that's not the case, that's not the reality. And so I went to look for some number. Recently, the UK did a study in 2023, retrospectively. The average birth rate, birth rate, meaning that an actual baby is born from IVF using fresh embryo transfer increased from 8% to 22% from 1991 to 2021, meaning that there has been improvement in terms of birth rate from IVF over the span of 20 years. However, keep in mind that it's only 22%. And in terms of pregnancy rate, for females under 30, they have 46% chance of getting pregnant after their first IVF cycle, while females between the age of 40 to 43 have less than 12% chance of success. So for pregnancy rate for people under 30, it's much more likely. However, the overall birth rate is still, like I said, about 22%. And in this study, the overall birth rate was 27.2%. The other one was 22%. This was a UK prospective cohort study from 2003 to 2012, and the sample size was over 150,000 people. Dr. Goulis really knew what he was talking about when he mentioned the birth rate is not that high. Now that I think about it, I do think that it makes sense, because for women with infertility, it's not always about the eggs that they have problem with. It's also the hormone, it's also the environment for the egg, which is the uterus. Sometimes it's not very welcoming to have a pregnancy. So that's probably why the birth rate is not that high. Also, just a side note that I also gathered from the interview with Dr. Goulis, he mentioned a very interesting alternative, which is to preserve your egg or sperm if you want to have a kid in the future. I really never thought about this as an option, because I mean, maybe I'm too young to think about it. But yeah, if you do plan to have a kid, probably that's a very safe thing to do, just in case that when you're ready to have it, but you can't. To sum up this episode, there are a few takeaway points that I like to emphasize. First of all, infertility should not be considered a personal or a couple problem. If anything, it's probably just another challenge that you and your partner and your doctor will get over sooner or later. Second, there are a lot of things that medicine can do for you, whatever the cause of your infertility is. So, yeah, you can be positive about it. And there's a very interesting alternative, which is to preserve your egg or sperm if you want to have a kid in the future. And last but not least, from your side, you can try to avoid some of the toxic substances that we mentioned. And also, you have to try to deal with stress differently, and very importantly, treat your STD. Thank you so much for listening throughout, and see you guys next time.